Back in early December of 2023, the Centers for Medicare and Medicaid Services issued a new Medicaid Unwinding Enforcement Rule that warned states if they don't comply with federal policies as they are moving through Medicaid unwinding, they could risk some of their federal funding. The rule took effect December 6th, and it offers assistance to states, but also that threat of penalty if they don't comply. The rule was deemed necessary as the data is starting to show damaging trends in disenrollment. States are being asked to redetermine eligibility for individuals held in continuous coverage during the COVID pandemic, but we are losing a lot of Medicaid enrollees, many for paperwork problems along the way. The Kaiser Family Foundation has updated their Medicaid Unwinding Data Tracker as of January 22, 2024. It shows right now, overall 15.75 million Medicaid enrollees have been disenrolled nationwide. Overall, about 33% of people who have completed a renewal were cut from Medicaid in the reporting states. That means about 67%, or about 30.6 million enrollees, were successfully renewed, and there is wide variation in the numbers coming in from states. Across all the states with available data, we know that about 71% of the people cut from Medicaid were terminated for procedural reasons: paperwork problems, computer glitches, they didn't get notices, they didn't submit verification items. Some sort of administrative hoop or hurdle or red tape kept them from completing their application, even if they otherwise would have been determined eligible. 38% of terminations were children, which is of particular concern to the federal government. 59% of renewals were administrative, or sometimes called ex parte renewals, which means the state has enough information on individuals to automatically process the renewal. They don't have to make the person go through all the administrative hoops and hurdles. Here's a look at the state of Wisconsin. So far, about 250,000 people have been disenrolled, while just over 400,000 have been successfully renewed. 60% of terminations are for procedural reasons or paperwork problems. 30% of those terminated are children, again, a particular concern to the federal government. 18% of renewals are administrative or ex parte. That is very low. It's the third lowest of all of the states. You can read more out of the federal government and look for yourself at that Kaiser Family Foundation tracker. We link to both in the description below.